Imagine a gymnast launching into a tumbling pass, or a trampoline athlete hitting the mat with incredible force to bounce, like 30 feet into the air.
Right.
We see the power, the precision, the absolute control. But hidden right beneath the surface of that elite athletic performance is a statistic that will completely change how you view these sports.
It really is a shocking number when you first hear it.
It is. Roughly 1 in 3 active young women experience urinary leakage during exercise. And when you look specifically at high-impact sports, like trampolining, that number can actually skyrocket to 80%.
Yeah, 80%. It completely shatters that common assumption you hear that, well, pelvic floor dysfunction only happens to older individuals or, women who have recently given birth.
Exactly.
We are looking at Olympians, professional CrossFitters, elite distance runners who are silently managing this reality every single time they step onto a competition floor or a training mat.
And welcome to today's deep dive. Because this issue is kept so quiet due to the stigma, the solutions these athletes use are often hidden from public view too. So we're going on a mission for you today.
A highly specialized mission, yeah.
Right. We are exploring a very specific piece of sports medical technology. For athletes who are just desperate to stay dry and avoid quitting the high-impact sports they love, can disposable urethral inserts, which are essentially urinary plugs, be safely used to prevent leaks?
And to get you a definitive answer on this, we've synthesized a stack of sources. We've got urology guidelines, clinical trial data, and sports medicine literature.
We really went everywhere for this one.
We did. We are going to examine the exact physiological mechanisms that cause the leak to begin with, the fluid dynamics of how these internal plugs actually work, the physical toll they can take on the body, and then the broader ecosystem of alternative devices on the market.
But, before we can even touch on how a urethral plug works, we need to establish why incredibly fit athletes are leaking in the first place.
Yeah, you have to understand the root cause.
Right, so the sports medicine sources specifically point to activities like gymnastics, CrossFit, distance running, and trampolining. The common denominator here is that they all generate sharp, sudden increases in what the medical literature calls intra-abdominal pressure.
Which brings us to the core mechanism of stress urinary incontinence, or SUI. So think about when you take a deep breath and brace your core to lift a really heavy weight.
Oh yeah, like right before a deadlift.
Exactly. Or when you land hard from a jump, your diaphragm pushes down and your abdominal muscles tighten up. This creates this massive spike in pressure inside your abdomen.
Okay.
SUI occurs when that sudden downward pressure inside the abdomen exceeds the maximum pressure the urethra can maintain to stay closed.
The sources gave a really helpful way for you to visualize this, actually. Think of the bladder like a full tube of toothpaste.
I love this analogy.
Right. It just makes so much sense. So a high-impact event like landing a box jump or hitting the absolute bottom of a heavy back squat is the equivalent of someone suddenly slamming their fist down on that tube of toothpaste.
Yeah.
If the cap is off, or, if the cap doesn't close fast enough, the toothpaste is just going to shoot out. In the human body, the pelvic floor muscles act as that cap.
And it's important to note the pelvic floor is a really complex network of muscles, most notably the levator ani group. But it doesn't just sit there like a passive bowl.
Right, it's not just a hammock.
Exactly.
Yeah.
It has a very active mechanical job. When intra-abdominal pressure spikes, the levator ani is supposed to forcefully contract, pulling the urethra forward and compressing it tightly against the pubic bone. It essentially kinks the hose shut.
But wait, I am struggling with the physics of this when it comes to elite competitors.
How so?
Well, these women are deadlifting twice their body weight. They have core strength most of us can't even fathom. How can their pelvic floor muscles, their quote-unquote cap, possibly be weak?
That's the thing. The medical data reveals it is rarely a matter of absolute weakness. Yeah. Many of these athletes actually have highly conditioned, hypertoned pelvic floor muscles. The failure usually comes down to muscle timing, neuromuscular coordination, or just simple tissue overload.
So it's not that they aren't strong enough.
Right. That contraction of the levator ania has to happen reflexively in milliseconds before the athlete's foot even hits the pavement.
Oh, wow. So it's like having a heavy-duty steel door on a bank vault, but the electronic sensor that triggers the lock is just firing a split second too late. By the time the lock engages, the door has already been blown open.
That captures the neurological side perfectly. It's a timing issue.
And what about the tissue overload you mentioned?
Well, then you have the physical fatigue side. The sources note that athletes consistently report more severe leakage toward the end of a grueling training session.
Okay, that makes sense.
Yeah, imagine a CrossFit athlete 15 minutes into an intense workout and she's doing her 50th box jump. The sheer downward force is repeatedly battering that muscle group over and over. Eventually, the muscular endurance just fades. The muscle doesn't have the stamina to maintain that split-second reflexive clamping force against the relentless spikes in abdominal pressure.
So if the biological cap on the toothpaste tube is fatiguing or, firing too late under extreme pressure, athletes naturally start looking for a way to artificially reinforce it.
Exactly. They want a physical blockade.
And that introduces the actual devices. When pelvic floor physical therapy is still in progress, or frankly, when an athlete simply cannot risk a leak during a critical one-time competition, we enter the highly specialized world of internal urethral inserts.
Yes, and these are small, disposable devices inserted directly into the urethra by the athlete to create a temporary physical barrier.
The sources detail a few designs, but the engineering behind one called the FemSoft insert really stands out to me. It's essentially a short, narrow silicone tube that is completely surrounded by a fluid-filled silicone sheath.
The design has to solve a very complex anatomical problem, though. The female urethra is short, usually only 3 to 4 centimeters long, and it is a incredibly dynamic, highly sensitive environment.
Right, so you can't just shove a rigid piece of plastic up there?
Absolutely not. A rigid plug would be excruciating, not to mention damaging. The fluid-filled sheath of the FemSoft insert is designed to remain soft and conform exactly to the unique contours of the individual's bladder neck.
Which is the opening where the bladder meets the urethra, right?
Exactly.
So the user leaves it in place while they compete. When they actually need to urinate, they either pull the device out entirely by a small external string, kind of like a tampon, or in the case of some other product designs, they deflate a tiny internal balloon to let the urine pass.
Right. There are a few variations on the removal mechanism.
Okay, let's unpack this. Because looking at the sheer fluid dynamics of this, I have a major question.
Go for it.
How does a fluid-filled silicone tube actually stay locked inside the body? I mean, if a lifter hits the bottom of a 300-pound squat, creating a massive spike in intra-abdominal pressure, wouldn't that pressure just shoot the insert right out of the body like a dart?
You would think so, right? But the physics of the insertion process actually prevent that from happening.
Okay, how?
The insert is guided into the urethra using this thin applicator probe. Before it goes in, the fluid inside that silicone sheath is all pooled at the proximal end.
The proximal end being the part outside the body.
Correct. So as the athlete pushes the device into the urethra, the mechanical pressure of moving through that narrow canal forces the fluid to transfer up into the distal end, the part that is actually entering the bladder.
Wait, so the fluid is actively moving from the outside of the body to the inside during the insertion process?
Yes, exactly. And once the tip of the device clears the urethra and enters the wider space of the bladder, the fluid balances out. It forms a soft, liquid-filled anchor that rests right on top of the bladder neck.
Oh, that is wild.
And to address your question about the pressure spike from a heavy squat, the intra-abdominal pressure actually pushes down on that fluid-filled anchor from inside the bladder.
Wait, really?
Yeah, it essentially presses the seal tighter against the opening rather than pushing it out. It uses the body's own downward force to maintain the blockade.
So we have a device that mechanically solves the problem. It physically stops the toothpaste from leaking out of the tube by adding an internal fluid dynamically anchored cap.
Yep, from an engineering standpoint, it works.
But, I mean, if this technology is so effective at physically stopping a leak, why isn't every single athlete with SUI carrying a box of these in their gym bag?
Well, the urology guidelines and clinical data introduce a massive catch here. Internal urethral plugs are explicitly not recommended as a popular or primary form of everyday incontinence treatment.
I have to ask, just as a layperson, putting a plug directly into the urethra sounds incredibly invasive and painful. Is this actually a viable option for someone to just casually use before a workout?
The medical consensus describes the sensation as highly uncomfortable, though, the severity varies wildly between individuals.
Because it's sensitive tissue.
Highly sensitive. The urethral lining is packed with nerve endings. But the physical discomfort of the device itself is actually secondary to the major medical risks associated with prolonged use.
And what are those risks?
The primary concern highlighted across multiple urology guidelines is a dramatically elevated risk of urinary tract infections.
Ah, because the female urethra is so short, Inserting a plug means you are creating a direct physical highway for bacteria from the outside world to travel straight up into the sterile environment of the bladder
Exactly. And on top of that, you are mechanically blocking the body's natural defense system.
by stopping the urine.
Right. The primary way the urinary tract keeps itself sterile is by periodically flushing bacteria out through the forceful flow of urine. If you leave a plug in place for hours at a time, bacteria have the opportunity to multiply undisturbed.
That sounds dangerous.
It is. Furthermore, the sources warn about potential hematuria, which is blood in the urine.
Oh, wow.
Yeah, the constant microscopic friction of a silicone tube rubbing against the delicate epithelial lining of the urethra during a high-movement sport like gymnastics, for instance, can easily cause minor abrasions and bleeding.
Which brings us directly to the core question of our mission today. Knowing all of that, knowing the very real risks of UTIs and urethral trauma, can these disposable urethral inserts be used safely during high-impact sports?
Yes, they can be used safely, but only under extremely strict parameters.
Okay.
The literature is very clear that their safety relies entirely on short-term application.
Meaning what, exactly?
We are talking about inserting the device immediately before a specific gymnastics routine, a targeted weightlifting session, or a hard run, and then removing it the moment the activity is over.
So no leaving it in all day.
Exactly. They cannot be treated like a daily management tool where an athlete wears one to the office for 8 hours and then heads to the gym.
So it all comes down to a calculated trade-off. The clinical sources mention that while these devices carry risks and do cause physical irritation, a lot of women find it to be a highly acceptable compromise.
Right, and to understand why an athlete would accept the risk of bleeding or a UTI, you really have to look at the severe psychological toll of stress urinary incontinence.
The mental side of it.
Exactly. The sports medicine texts document that female athletes will frequently alter their biomechanics just to avoid leaking. They might avoid hitting full depth on a squat, or they will deliberately restrict their fluid intake for 12 hours before a major competition.
Which is absolutely devastating for athletic performance. I mean, dehydrating yourself before a high-intensity event destroys your muscle endurance, cognitive focus, and your recovery timeline.
It sabotages everything they've worked for. And some athletes go as far as entirely quitting the sports they are passionate about due to the sheer shame and stigma of leaking in front of judges, teammates, or a crowd.
When you frame it like that, dealing with temporary physical irritation from a silicone plug for 60 minutes starts to make complete sense.
It really does.
If it means an athlete can hydrate properly, hit her personal best on a deadlift, and compete without the paralyzing anxiety of a visible leak, that internal barrier provides profound psychological relief.
It restores their agency. But because the risks of traversing the urethra are so high, athletes and medical researchers have naturally sought out alternatives. They want the security of the barrier without the infection risks of actually going inside the urinary tract.
Which opens up a broader ecosystem of disposable barrier devices designed to tackle the problem without ever crossing that sterile boundary. If you don't want to go inside, you have to work from the outside.
Right. And the clinical texts outline two major non-internal alternatives. You have external urethral devices and vaginal inserts.
The external devices are actually fascinating from a material science perspective. Products like the Moxie Patch or Finesse are not plugs at all.
No, they're completely different.
They're made from a soft, biocompatible foam or silicone pad that's equipped with a specialized hydrogel adhesive. So the athlete places this pad directly over the external urethral opening, and it adheres to the surrounding skin, forming a temporary waterproof seal.
The primary advantage here is obviously safety. Because they are not indwelling, meaning they do not enter the urethra at all, the risk of introducing bacteria to the bladder drops significantly.
Which is huge.
It is. The athlete just applies the patch before the workout and simply peels it off and throws it away when they need to urinate.
But the sources highlight a very practical challenge for athletes using these. For that hydrogel adhesive to form a strong enough bond to actually withstand the pressure of a heavy lift, the mucosal tissue surrounding the urethra has to be completely bone dry during application.
And let's be real, maintaining a secure adhesive seal while an athlete is heavily sweating, running, or tumbling is incredibly difficult.
Practically impossible sometimes.
Right. Furthermore, some clinical trials noted that while external patches are great for light leaks, they often fail to hold back the sheer volume of fluid generated by severe stress incontinence under maximum abdominal pressure.
It just pops right off.
Yeah, the pressure simply blows the adhesive seal completely off the skin.
Well, here's where it gets really interesting. That leads us to the second major alternative.
Hmm.
Disposable vaginal inserts, like the Poise Impressa or the Aresta device. These take a completely different anatomical approach. They don't try to plug or seal the urethra at all.
No, they utilize the spatial relationship of the female pelvic anatomy. You see, the urethra and the vagina sit immediately adjacent to each other, separated by a relatively thin wall of tissue.
Right, and these inserts, they look and function somewhat similarly to a standard menstrual tampon during insertion, but their structural geometry is entirely different once they're in.
Exactly. Once inserted into the vagina, they have rigid internal frames or specific shapes that push forward, applying gentle but firm pressure directly against the anterior vaginal wall.
So if we bring back our visualization of the bladder as a tube of toothpaste.
Oh, this paints a perfect picture.
Right. So if the internal urethral plug is like shoving a cork directly down into the opening of the toothpaste tube, and the external adhesive device is like slapping heavy-duty waterproof tape right over the top of the hole.
The vaginal insert acts completely differently.
It is the equivalent of wrapping your hand tightly around the neck of the toothpaste tube from the outside, squeezing the plastic walls together so that no matter how hard someone punches the bottom of the tube, nothing can travel up and out the top.
That is exactly how it works. By applying forward pressure from inside the vagina, the insert provides a rigid mechanical backstop for the urethra.
So it's reinforcing the pipe from the outside.
Right. When the athlete lands a jump and abdominal pressure spikes, the urethra is compressed tightly against that insert, stabilizing the bladder neck and kinking the hose shut.
And the data supports this.
The clinical data on this mechanism is remarkably strong, actually. One study analyzing the Aresta vaginal device showed that 17 out of 20 women experienced a significant reduction in leakage volume.
Wow.
And for 6 out of 10 women, the leaking was completely eliminated during physical activity.
And because they aren't blocking the urethra directly or, relying on skin adhesives, they offer much more flexibility. A vaginal device like the Impressa can be safely worn for up to 12 hours, though it is single-use and disposable.
That's a massive advantage over the urethral plugs.
Definitely. And crucially, because it's only providing structural support from behind the wall and not forming a hard blockade in the pipe itself, the user can usually sit down on a toilet and urinate normally without having to remove the device first.
The existence of this entire ecosystem, the internal fluid plugs, the external hydrogel seals, and the structural vaginal supports, it really demonstrates that managing stress urinary incontinence in sports requires highly personalized experimentation.
There's no one-size-fits-all.
Not at all. An athlete has to navigate her own specific anatomical geometry, the exact physical demands of her sport, and her personal tolerance for physical discomfort to find the right tool.
So bringing all of this data together for you, the answer to the core question of our mission today is a heavily qualified yes. Disposable urethral inserts and plugs absolutely can be safely used by athletes during high-impact sports to prevent leaks.
But they are a hyper-specific, highly conditional tool.
Exactly.
Any athlete considering internal plugs has to strictly manage their application. Their safety profile relies entirely on brief, targeted use.
Like putting it in for just a single gymnastics meet or weightlifting session.
Right, specifically to mitigate those significant risks of urinary tract infections and urethral trauma. They do not cure the underlying neuromuscular timing issues, and they absolutely do not replace the long-term benefits of targeted pelvic floor physical therapy.
But for the hour that an athlete is on the competition floor, they are a powerful management tool.
They keep athletes in the game safely and confidently.
And that leaves us with one final concept to think about today. The medical literature makes it very clear that athletes are dangerously dehydrating themselves, modifying their explosive movements, and just walking away from the sports they love entirely because of the stigma and shame surrounding urinary leakage.
It's a huge problem.
It is. Yet if you walk into any CrossFit box, weightlifting gym, or track meet, you will see athletes covered in highly specific functional gear. You see thick neoprene knee sleeves, rigid leather lifting belts, stiff wrist straps, and specialized compressive footwear.
And every single one of those items is designed to externally support a specific joint, spine, or muscle group under extreme physiological loads.
Right. And nobody blinks an eye at a weightlifting belt. So if we as a culture have completely normalized wearing highly specialized supportive gear to protect our joints and our spines from failing under pressure, when will society finally normalize functional pelvic floor gear?
That's a great question.
When will a disposable urethral insert or a supportive vaginal device transition from being a hidden source of shame to just being another standard, stigma-free piece of athletic equipment sitting right next to the lifting chalk and the athletic tape in a gym bag. It is time we stop hiding the reality of the pressure and start openly talking about how to reinforce the cap.